Hello.
Hey.
I'm Rachel Basso. I'm here with Clara Health, and we're interviewing a patient, Hannah Bialik, who's going to be sharing her story with psoriasis with us. So, Hannah, if you want to tell us a little bit about yourself.
Sure. My name's Hannah Bialik, and I'm from Middleborough, Massachusetts, which is an hour south of Boston. I went to Northeastern University, which is where I met Rachel, and I was diagnosed with psoriasis when I was 19. It's genetic. My mother also, well, it can be genetic. It is for me. My mother also has it. And currently, I'm studying a master's for immunology and inflammatory disease at the University of Glasgow in Scotland.
Awesome. Thanks, Hannah. So, to start it off, can you tell us about your journey to diagnosis and how you learned you had psoriasis?
Sure. So I was diagnosed with strep throat in 2013. I promise this is related. And I was given antibiotics, and usually get a bit of strained reaction to antibiotics. So when I broke out in a rash, I thought it just might be an allergy. And so it also kind of looks similar to the chickenpox. So I went to the ER, and when I was there, they told me I actually had psoriasis. So the first breakout was pretty awful. It covered me basically head to toe. I had all over my face. My skin was super irritable. It itched like the worst bout of poison ivy you can imagine. And I had watched my mother struggle with psoriasis my whole life. So I'll admit that the diagnosis was a bit devastating. I wanted it to be anything else because, it's not just unattractive. It's not a good thing to have. I mean, it's an autoimmune disease, so I knew it's never going to go away. And my mother's is specifically hard to manage, so I thought it would be the same for me, which it is to a point. Thankfully, my first flare-up was actually the worst, and it has become manageable over time with treatment, diet, and with stress.
That's great. Do you think it helped you to have your mom supporting you and have her be a patient as well while you were going through your diagnosis?
It definitely was because I have noticed that not a lot of people know exactly what psoriasis is.
Mm-hmm.
So it was nice to have someone I didn't have to explain it to. And she could also talk me through how she dealt with it treatment wise and emotionally, because it does make you feel pretty bad about yourself. I mean, especially when it stopped going away. For the first couple summers, it would go away and it would come back in the winter. But since, after that first year, I've just had it on my legs all year. So it's nice to have someone who kind of understands that, it's something you just live with. It's manageable, but it's okay to feel a little bit bad about it sometimes.
Mm-hmm. Yeah, that's awesome. And it brings me into my next question for you, which is how has your life kind of changed since you've been diagnosed with psoriasis? And what's your day-to-day struggles and triumphs?
So it definitely forced me to feel better about myself as a person and my accomplishments and my personality than my appearance. I think the time I was diagnosed was definitely, it's the beginning of college. So how you look matters a lot more than I think any other time in your life, maybe except high school. But you're surrounded by people all the time and you're always comparing yourself to them. So it was a really formative time to then be given this kind of disgusting, hindering rash that I couldn't hide, and that when people would see it, they would, think I was contagious. And I had some pretty uncomfortable interactions that really forced me to realize if I kept attaching psoriasis to my self-worth, then I was going to have a very long and unhappy life. So I was sensitive and I was pretty insecure at first. But again, I just adjusted to, instead of being embarrassed by hiding my legs and arms, I just dressed as I wanted to, and I embraced the fact that people were going to ask.
Mm-hmm.
And I just reminded myself that, if someone has a deformity, people tend to look and then look away. It's just human nature. People are curious. The fact that people would even ask, like, what is that? I shouldn't take as an insult of them pointing out something I don't like about myself. I should just take it as a chance to educate others about psoriasis and just autoimmune diseases in general.
That's amazing. Do you have any particular examples of a time when someone asked you about it and you felt like your answer really resonated with them?
Yes. Well, there's two stories I can give. One where I was on the side of being asked, and the other time where it kind of built a bridge. When I used to work at Dana-Farber, it was my first real winter with having psoriasis, and it was pretty bad. I mean, covered my arms, and it did look, it didn't. It's not what someone imagines when they think of like eczema or some type of rash. It looks contagious. It looks like a disease. And I remember one of my coworkers, who very intelligent person, I know they didn't need to hurt my feelings. They kind of grabbed my wrist and were like, "Should you go to the hospital? That looks really bad."
Wow.
And I kind of like choked back, tearing up a little bit because it really hurt my feelings. You know, I had tried to dress nice that day. I remember I actively like tried to look nice because I felt good that day, and it tore me down. And then they saw I got really upset, and I explained to them I was really sensitive, and they said that, you know, they just didn't know what it was, and it changed how they would approach someone in the future. So that was a really nice experience for me. Again, it started out bad, but ended nice. And the other story that comes to mind is when I used to do boxing at the University of Edinburgh. One of the girls on the club I noticed had the same, it kind of looks like vitiligo when it goes away. It's just like patches of no pigment skin. And I noticed she had that on her arms. And I asked, you know, not to intrude, but do you have psoriasis? And she was like, yeah. And I was like, oh, I do too. And it was automatically a bond that I wouldn't have had if I didn't have psoriasis. So I was very thankful in that moment that I had it. And we shared like treatment ideas and how we manage it. And it was really fun.
That's a really good segue again into talking about treatments. What types of treatments have you used? What have you had success with? What I'll let you take it.
So I'm not the best person to talk about treatments solely because most of the ones I've tried haven't worked. I have tried a lot though. I started out with steroid cream, hydrocortisone, and it would, to a point, make the rash a little bit better, but it also eradicated my hair follicles. And it was just something that I didn't like the side effects of, and it made my skin really flaky and weak. And I thought, you know, if I'm going to have this the rest of my life and I'm going to destroy my skin, I might as well wait a couple of years before doing that, especially in the summer when you're already the sun is helping with your psoriasis because UV light, specifically UVB rays, are really good for this type of rash. Mm-hmm. Not really sure why. Would like to learn one day, maybe discover the reason myself. But it's just not good to have your skin that thin. I've tried, you know, colloid silver. I've tried different moisturizer, you know, different exfoliating creams. And the thing with psoriasis is it's very individualistic. So what works for someone doesn't work for others. So a lot of the things I tried didn't work. MG 217 is a big cream that is coal tar mixed with something else, and it works for a lot of people. No effect to me. In fact, it made my rash worse. Mm-hmm. But aside from that, the one thing that I have found that's good for me is for my scalp psoriasis, which is a little different than just normal psoriasis, and not everyone who has psoriasis also has scalp psoriasis. I've used coal tar shampoo, which you can get at CVS, Walgreens, Hannaford's, anywhere. And it really helps. It's like severe dandruff shampoo.
That's awesome.
It doesn't smell that bad.
It's smelling nice is a part for sure. Yes. So while you've been going through this, trying to figure out what works and what doesn't, what's the process been like when looking for something new and finding yourself frustrated?
Yeah, so usually it's just Googling, buying it, hoping it works. There's no clause for any of these creams that, you know, if it makes your skin worse or it doesn't help at all, send it back. So, you know, it's kind of just trial and error. And one thing I forgot to mention is I actually have two different types of psoriasis. Besides the scalp, it's guttate on my arms and plaque on my legs. And so each of these types, you have to target specific treatment for that. Like the ones on my legs are much more resilient. So something that might work on my arms may not work on my legs. Right. But, you know, I've also talked to a lot of people with psoriasis, and we kind of share tips and tricks. But something that I found also works decently well is pairing anything I try with low stress level and a good diet, and eating foods that are traditionally non-inflammatory. So I lower, you know, sugars, just anything that could cause my body to slightly reject it, try to stay away from. And if I try a new treatment and I pair it with a good diet and no stress, then sometimes I'll have better results otherwise. But it is kind of frustrating looking for new things because you waste a lot of money.
Yes. Yeah. So I know you know this, but our viewers may not. I'm actually an autoimmune patient as well. I have endometriosis. So for me, I've been through a lot of those same treatments and trial and error as you have, Hannah. And I've also found that right now the best thing that you can do for it is eat healthy and take care of yourself and do the little things. But I think this is why we're friends and why many patients are in the same shoes as we are, where we really advocate for better care, is because we're not satisfied with the fact that there aren't treatments. So I know your dissatisfaction with the lack of treatments and the lack of a cure in psoriasis has led you to change the path of your life. And so I'll let you talk a little bit about what you're doing right now in grad school and what you hope to accomplish in the future.
Yeah, so I right now am doing a master's in immunology and inflammatory disease because I would like to dedicate my life. I've always wanted to dedicate to science, but specifically after my diagnosis and meeting wonderful people like you who also suffer from autoimmune disease, I just want to figure it out. And I know that obviously very different diseases, endometriosis to Crohn's to any IBD disease to psoriasis to lupus to diabetes, very different. But one thing in common is it's dysregulation of the immune system. It's overactivation of what should only be happening if you're sick. Um, and actually, just in the month I've been at school, I've learned so much more. It's unbelievable. I feel that there is definitely something one day that will be figured out that will fully cure autoimmune disease. And hopefully with that, I mean, provide a new pathway to treating and maybe even preventing cancer, because cancer is the opposite end of the spectrum. Your immune system isn't taking care of something that it should be. So it's exciting that I have a personal connection to it. And it definitely drives me to want it a lot more and to want to make a difference more than I think if I didn't care as much, if that makes sense.
Yeah, that makes sense. That's awesome. So do you have any kind of closing thoughts you want to share with other psoriasis patients, or thoughts about what you hope for the future, what you hope for others?
Well, and of course, I know this is good for you guys. I would love to participate in a clinical trial. And I really hope whatever I do in the future allows me to, because I know there's unbelievable drugs that are being developed right now. And I know one of them that's in a stage 2 or 3 clinical trial that specifically targets the T cell that is dysregulated in psoriasis, which there hasn't been a drug that legitimately works like that before.
Mm-hmm.
So that's one thing that I'm extremely hoping eventually that I will be able to participate in. I urge other people who suffer from psoriasis to not just look for new treatments, but see if there's anything that you would be interested in so you could contribute back to society. Well, the Autoimmune Disease Society. You don't have to be a researcher or work for a pharmaceutical company or make the drugs to do something good. So that's probably what I would like to give.
That's awesome. Thank you so much, Hannah. You're really an inspiration, and we're so happy to have you as a member of the Breakthrough Crew and here to talk and share your patient story with others. I always have found you an inspiration, and I think everyone else will too. So thank you so much for joining us, and that's all we have for today.
Bye. Thanks for having me.
Bye.